We're here to share information about weight management. And what I'd like to do is invite Dr. Harvey to share her ideas and her sharing her comments on the experiences that she sees about the improvement that she sees with patients from Tesla Wave Sims. We also have, other than all of our corporate individuals and our CEO and founder for creating this company, we have thanks to be given to Nikola Tesla, who was the discoverer of frequencies many, many decades ago. It's because of Nikola Tesla that we have all of the conveniences that we have in the modern day world today. So without further ado, I'm going to ask Dr. Harvey to join us as she has. And Dr. Harvey's many, many years of working with frequencies and understanding frequencies, her patients have benefited in many, many ways. Dr. Harvey's experiences and knowledge base is quite extensive. On this particular slide, I'm sharing very little, but in other slides, when we come across them while Dr. Harvey is speaking, you can see all of her experiences and her credentials and how she has embraced Tesla Wave. So Dr. Harvey, with that said, please go ahead and join me by sharing some thoughts and provoking concepts of what you're seeing with your patients and your treatments that you're offering patients, specifically with weight management sims and the combination of weight management sims with other sims.
Thank you. Welcome. Thank you, John. Thank you. I always really enjoy participating with this Zoom with Tesla Wave, because as everybody knows, I love the product. And I was thinking, I think you're 4.5 years into this product. And as you were talking, I thought, you know, I look at you and I watch you work or be around young men who are 19, 20, and you literally outwork them. You have that much energy. And you had energy before, but you're not getting older. You've got so much life in you. You literally run circles around everybody else. And it's funny, if you want something done, ask a busy person. And I'm like, John actually does the work of 7 different other people. So it could be attributed to those Saskatchewan bones, or it could be also the Sims or the great food you eat or all that motivates you. Okay, so let's talk about the weight sims, but I'm going to start with this. I was out earlier this afternoon, and I was listening to people talk. And, you know, they say as you get older, you know, you talk about your appointments and, you know, the meds you're on. And in the last 24 hours, I've spoken to 3 people, and this is morbid, but it's going to have a nice lighter tone to it. I've spoken to 3 people that know 4 to 5 people that have died in the last 2 months. Massive heart attacks and very rapid cancer. And I'm just shaking my head going, you know, we have options. And even earlier today, you know, someone says, oh, well, my friend, I'm really upset. My friend has COPD, which is basically the obstruction of the lungs. They can't breathe. The lungs are shutting down. And these people were listing, oh, this person has a heart problem. That person has a light heart problem. They're leaving early and they're selling their house. And I'm just sitting listening, and I'm feeling like, you know, the kid in class going, pick me, pick me, pick me. I'm literally listening to these people saying, you have options. You have options. It's not that hard. Start the program now. Reverse COPD. Reverse MS. Reverse diverticulitis. You know, it's like, no, you don't understand. I've got diverticulitis. And I just think, I do understand. I do. Commit yourself to a program of getting better. And you will. I've asked other people that jump on board with me who really want to get better. And I really like the tough tough illnesses. Like to me, COPD, give me 6 months and we will have you breathing. We will have you we will have your chest open. We will have you breathing. We won't have you out of it completely, but we'll have you as a completely different person. Like I said to the individual that I mentioned two things ago, he's literally drowning in his own water, like literally. And it's like this, we've got the stims. So where I'm going with this is, you know, I say to most people, if you don't have any sims, just put a performance on. And then, you know, we talked about discomfort, and, you know, if anyone's in pain, basically put the discomfort on the one spot. If the pain doesn't completely go away, then put it on, mirror it completely the opposite side. And what I'm doing a review, put it on the opposite side, exactly mirroring the other spot. And usually that will bring the pain down to 1 out of 10, if it's been a 9 or a 10. Usually that's the case. Oh, and I was just thinking, John and I know someone that can't seem to close their hands. And John sent me a whole bunch of videos. And, you know, performance, all you have to do is put it on all the 5 fingers. And within 10 minutes, the fingers start to move again. Less restriction. So those are pain. Those are mobility. You don't know what to use a performance. But now I'm going to go into weight. If you know somebody who has a chronic illness, a chronic digestive problem, and here's the thing, anyone who has a chronic something, their digestive system is going to need help. I'm, you know, 9 out of 10 when I'm working with someone, and I was speaking to someone today, and remember, you know, I'm going to keep adding tidbits. This person was an engineer. His wife has blue fingers. So I just started to teach him a few things, and this is all digestive, so it's all going to come in with the weight sims. I said, all foods have a temperature. I said, cucumbers, hot or cold? He got it, cold. I said, watermelon, hot or cold? He said, cold. I said, bananas, hot or cold? Cold. I said, oh, you get this. I said, ginger, hot or cold? Hot. I said, yes, you get this. I said, so your wife, does she eat bananas? He said, yes. I said, does she have cold food? Yes. I said, well, start getting her to have warm food. In this particular case where his wife has blue fingers, yes, we can put performance on the fingers to get this circulation going, and we can also use the male stims. I like the male stims for a boost of energy, like real big boost. But something has shut down in her body. She doesn't have an appetite. So what would I add to her protocol? Definitely weight sims. 2 inches away from the belly button is the easiest ones for the placement. Because something in her system is shutting down. And I'm going to generalize. Whenever I'm working with someone, I'm going to be bringing in the weight sims at some point in the very, very early stages of working with them. Yes, we know they lose weight. And, you know, I can talk about that. Even Ed, there's tons of photos of Ed who dropped, you know, what was it, 1,002 pounds? And he didn't change anything at all. All he did was put the weight sims on. But I use them in a very, very different way. Is that, what was it? I take the ferry a lot. And that's, you know, people always say, well, what do you do? And I say, I change people's lives. And it opens up the sims and the conversation. But he has IBS. So I said, do you mind lifting up your shirt? I just want to put a few sims on you. And I put them right beside his belly button. So I don't use just the weight sims for losing weight. Anytime there's an imbalance with the digestive system, like, for example, excessive phlegm. I went and did a house call the other day, and the husband just kept clearing his throat. and clearing his throat and clearing his throat. And I said, is your husband doing that all the time? You know, definitely use an allergy on him, but I would definitely also start putting weight sims on him to improve the digestive system. Because in some philosophies in Oriental medicine, the phlegm is made in the digestive system, but stored in the lungs. This is why you see people that can't breathe at all. And I was talking to a young man, and he can't breathe. He's having anxiety because he can't breathe. And I'm thinking, and I'm going to give you some tidbits, and I'm going to give you the extra information. And I always say to all my patients when I speak to them, pen and paper, have it ready, because I'm going to give you a ton of information. This young man is having anxiety, massive phlegm. His mouth is so dry. I know he enjoys alcohol, and I think he's also enjoying a little bit of the bud. And so I'm looking at that, and the bud is a dehydrator, alcohol is a dehydrator. And I watched this young man eat we got some advertisements coming up behind me. Not sure what they're selling. And he eats 2 massive burgers. And I'm watching that, and I said to him, I said, you know, those 2 burgers you just ate is going to take minimum 5 days to get rid of that phlegm. I said, the average individual has 4 to 6 pints of phlegm in their body, and it's lubricants in our joints and our knees. It's a necessity, and I'm using Oriental terminology. But when you start to have too much, this young man has 10 pints of phlegm in his body, and he doesn't understand why he's choking. And I keep reinforcing with this young man, but definitely the weight sims to get his digestive system working so much better. Same with, and I always want to use it with a combination, because I'm working with one woman who introduced me to start working with her husband. And when she's seeing the changes with her husband, she's now jumping on board. And I had to use a lot of heart sims because she wasn't breathing. And now as soon as her body starts to change, I'm definitely bringing in the weight sims next to speed up the movement of the digestive system. Remember, I always talk about a triangle. Always. I'm always looking for a triangle with someone's body. So we have the weight sims. You take a look. We're going to do it for weight loss. What else is going on? So if you've got your go-to and you got your performance, and you go, okay, I got the performance, and then you've got your next go-to is the discomfort. Pain here, put it here. Okay, you got that. And you're going, well, what's my next go-to? You want to boost someone's energy, so you put the male sim on. Someone's mind is really fatigued and exhausted. I love the female sims. But when you want to make a really nice, for lack of better terms, ensemble, I will always get the weight sim in to just really start to kickstart the digestive system. And so this young woman, we're getting her heart functioning because she's locked in fear and she's not breathing, and she has a few extra pounds. So we get the heart sim working, and then I was using stress on her, and then I started to bring in the weight sims because I wanted again to kickstart her digestive system. And she starts saying, well, I can't eat the food I like. And they would think that I would be upset about that. I'm not. As soon as we start to wake up the digestive system, the poisons or the foods that your body doesn't want to eat will immediately start to say no. You'll bloat. You'll be belching. I love when that happens because it tells me the digestive system is waking up. If you just want to do weight loss, then okay, put the weight sims and you find your belly button 2 inches to both sides. If you really want to enhance weight loss, then definitely go put a performance maybe 1 below on either side, or make it into a diamond or a kite. 2 performances, an inch and a half below the belly button, an inch and a half above it. But remember, always look for the triangle. If the digestive system is not working and you're putting those Sims on the digestive system, but they're not losing weight, look to see, do they have excessive phlegm? Are they tired all the time? So, I'm helping you as I'm talking, figure things out on your own. So if they're tired all the time, male Sims on their kidneys, right in the back. Performance Sims to enhance it. If they're lethargic, it's almost like hopelessness. They just look at life and, definitely get the heart Sims on. So what I'm saying is we're enhancing the weight loss potential of the weight Sims with a male Sim and a heart Sim to just motivate the body to lose weight faster. I'm going to repeat. We also have, if we have somebody with digestive problems, diverticulitis, Crohn's, IBS, I love using the weight Sims. And they say, well, I don't need to lose any weight. And I'm going, it's not about losing weight. These are magnificent for rebalancing the digestive system. That's what I've found with my patients. So, and again, something like Crohn's, diverticulitis, IBS, takes time, and a lot of time. If you've got someone with IBS, I find I need to really strengthen the kidneys quite a bit. I'm going to backtrack talking to this gentleman and his wife with the blue fingers. Her digestive system is exhausted, absolutely exhausted. I looked at her and I said, well, what does your wife eat for breakfast? Oh, she doesn't eat breakfast. And I was looking at it going, oh, she's a twig. She's a little bird. So she has no energy going to her hands, none. She has no energy in her belly. She has no appetite. So definitely to stimulate the digestive system and to give her an appetite, weight Sims. Now I'm looking at the gentleman, and this is where I go, get your pen and paper ready. I said, show me your hands. And so something I will do is if I have a group of people, I say, everybody show us our hands. He showed me his hands. His hands were reddish pink with lots of blotches in it. Well, when I see too much white like that, I think, what's going on with the lungs? And then he showed me his nails. If you anytime you want to diagnose people, or not diagnose, I'll use a different word, wonder what's going on with them, look at the nails. Are they healthy? Are they strong? Are they cracked? Do they flip up? All these little things tell us what's going on in the body, because nails should be healthy and strong and growing without ridges, without little dents in them. And I see all these women with all the nail polish on it, and I'm thinking, wow, you're poisoning your body. You look pretty, but you're poisoning your body with all those chemicals on your nails. So this gentleman had very dry nails. His nails were flipping up and they were flat. They had no curve to it. Okay, I don't even have to ask, but I know his digestive system is very, very tired. So that would be one of my first beginners, is to use the weight Sims, again, 2 inches away from the belly button, both sides. And, if I tried to explain it to him, because he's highly scientific, he'll say, this doesn't make sense. You think my nails are going to get better by putting a weight Sim on my belly? Yes, absolutely. Because the digestive system is tired. And I say to people, the only thing keeping you going is your stomach. No. My mind is going, and I'm like, yeah, okay. But if you're not eating the right foods, your digestive system is going to shut down. And I'm seeing so many people with so much edema. well, okay. Western medicine would say, okay, that's the kidneys. They're having major kidney problems because they have so much water in their legs. And I'm like, no, let's wake up their digestive system. I was working with a woman, and her kidneys were shutting down. And every time, and she spoke Spanish and I spoke English, she kept asking me, how are my kidneys? How are my kidneys? With this big fear in her eyes. And she says, my kidneys are shutting down. And I kept looking at her going, okay, I'm going to support the kidneys. And that's an easy one. The male Sims are great from my experience to use those. But I looked at her and she had all this water around her ankles. That's not just the kidneys. That's her digestive system. So I kept saying to her, I just need to wake up your digestive system a little bit. And she just kept saying, no, my kidneys, my kidneys. And you can't just focus on one thing in the body, like COPD, where someone's drowning in their own phlegm in the lungs. Where do you think you're going to get the energy to bring up that excessive stuff congesting your lungs? You need the energy from the rest of your body, which is the digestive system. So really focus on strengthen the digestive system, especially if you're working with someone with a very, very hard chronic illness. All right, I'm taking a breath. Does anybody have any questions?
I see Dr. Bond has sent a chat piece. So, Dr. Harvey?
I saw the question. So okay. If I really want to enhance someone's digestive system, for example, I'm working with someone and they're saying, I haven't had bowel movements since I was a baby. My mother would have to really work hard with that and sometimes assist when I was a baby to have bowel movements. And I thought, you know what, let's really push hard on this one. Ha ha ha, that's funny. So where the belly button is, always the easiest is 2 inches away from the belly button. It's actually stomach 25. And then if I really want to enhance it, I'll put performance 1 inch below those two on both sides. Or I will choose to put performance 1.5 inches below the belly button and 1.5 inches above the belly button. And if this person's very, very tired, or we call it cock's-crow diarrhea, if they have loose stool, especially in the morning, as soon as they wake up, they have diarrhea, I would definitely put the male Sims in the kidney area in the back. So weight loss 2 inches away from the belly button, performance 1 inch below those two Sims, or where the belly button is, go 1.5 inches below and 1.5 inches above, so it kind of looks like a diamond. Any other questions?
Well, with regards to Dr. Bond, question, have you covered that off completely?
Yes, she wanted to know. So here's one.
Okay.
Lethargic and hopeless and using heart Sims, where would you put them? The easiest one is 2 inches down from the wrist, or 2 inches down from the wrist and over 1 centimeter. And then the question I would ask, do we know that the heart's lethargic or the heart is exhausted? There's two different ones. When the heart is sluggish, you can get it moving just by doing activity. But if it's like really exhausted, that one's different. So, and the other thing too is the heart, are they, I call it the squirrel. Where's my nuts? Where's my nuts? Where's my nuts? Where's my nuts? If somebody is in that particular type of frame where they can't bring the systems down or relax themselves, I would take a heart and I'd put it 2 inches below the wrist, right in the center, or at the end of the crease in the elbow, right here, is magnificent for just a general soothing of the person, especially if they're really struggling with what I see as hopelessness. I would put the heart one at the end of the elbow where the crease is with hopelessness. If they're a squirrel looking for their nuts, I would put that 2 inches away from the wrist in the center.
If I may, your screen or your visual video has
Am I
frozen.
back? Okay. What about now?
Now you're back on. So obviously
Okay.
It's an internet connection.
Okay, so if someone's just hopelessness and very, very tired, end of the crease right here, and we don't put it in the crease because every time you bend your elbow, you're bending the sim. So just at the very end around that really soft flesh, we put it right here. But if it's someone looking for their nuts, where are my nuts, always in a panic, I would put the heart sims here, 2 inches away, right in the center. Any more questions?
No, you're doing. You're providing a lot of information, and for anyone that.
So that's what I want to share about the weight sims. I like the versatility of them. I don't just use them for weight loss. I use them to enhancing the digestive system, especially with this sluggish system, exhausted system, excessive phlegm. Whenever there's excessive phlegm, and they're just constantly clearing their throat, and they actually, some people sound like horses. The job would be getting the body to eliminate the phlegm so that the digestive system can be stronger.
Great information, Dr. Harvey. We're always appreciated.